You are listening to the Pregnancy Podcast with Vanessa Merton.
Hello. Thank you for tuning into the Pregnancy Podcast. Today's episode is about understanding your options for fetal heart rate monitoring. Your doctor or midwife will monitor the fetal heart rate of your baby to assess their well-being and to measure how well they are tolerating labor. They primarily will use electronic fetal monitoring. That is the most common obstetric procedure during labor. Electronic fetal monitoring allows your doctor or midwife to recognize signs of your baby having low oxygen and to respond quickly if an intervention is needed. While electronic fetal monitoring can identify emergencies, research shows that continuous monitoring does not necessarily improve outcomes and is linked to higher rates of cesarean and assisted births. Most low-risk pregnancies can be safely monitored intermittently. But things like hospital policies, provider training, individual risk factors all influence what type of monitoring your doctor or midwife will recommend. By learning about your options and discussing them ahead of time, you and your care provider can create a plan that keeps your baby safe while supporting the birth experience that you want. You can find the full article and all of the resources for this episode at pregnancypodcast.com/monitoring. This week, I am offering something very special that I have never done before. When you sign up for a 3-month membership of Pregnancy Podcast Premium, you get ad-free access to every episode, the complete archive, a copy of the Your Birth Plan book, and a private 30-minute call with me. We can talk about your birth plan. I can help get through some of your pregnancy questions, or chat about anything that will help you feel more confident and prepared to meet your baby. Of course, I am not a doctor. I cannot give medical advice, but I am a wealth of information and I'm an expert at connecting you with evidence-based resources. Over the last decade, I have helped tens of thousands of expecting parents navigate pregnancy and birth, and I am so excited to work with you one-on-one. This is a limited time offer available only through the website. This is not available on Apple Podcasts. This special offer is only good through October 31st, 2025. On top of ad-free listening, full archive access, we get to hop on a call and tackle whatever you're struggling with in pregnancy, plan for your birth, or even prepare for postpartum. Check it out at pregnancypodcast.com/premium. VTech offers a wide range of baby monitors, and they are the #1 baby monitor brand in North America. They're trusted by millions of families to deliver crystal clear HD video, reliable performance, and strong night vision. The Advanced HQ Max is built for parents who want an easy-to-use, secure monitor without the need for Wi-Fi or apps. With a large 7-inch screen and crisp real-time video, it provides reliable monitoring without the lag. Save 20% with the code VTPodcast20 and check out the VTech Advanced HQ Max at pregnancypodcast.com/HQMax. The True Belly Serum from 8 Sheep Organics is specially formulated with clinically proven ingredients that penetrate deep into the skin to effectively prevent stretch marks. The best part? You can try it risk-free for 100 days. Like all 8 Sheep Organics products, it comes with a 100-day happiness guarantee. Save 10% off all 8 Sheep Organics products at pregnancypodcast.com/8sheep. That's the number 8 and sheep like the animal. 8 sheep. From your care provider's standpoint, monitoring your baby's heart rate is the best way to track your baby's well-being during labor and to alert them if there is a problem. Electronic fetal monitoring is a method that's used to continuously record your baby's heartbeat and your contractions during labor. This uses sensors that are placed on your abdomen, or sometimes they can use a small electrode placed on your baby's scalp, and they measure and record both the fetal heart rate and the timing and strength of contractions. The information will appear as a graph on a screen or a paper printout that shows how your baby's heart rate responds to contractions over time. This helps your care provider assess how your baby is tolerating labor and alerts them to any signs of distress. According to the American College of Obstetricians and Gynecologists, electronic fetal monitoring is the most common obstetric procedure in the United States. Nearly 90% of pregnant patients undergo electronic fetal monitoring during labor. Plus, this procedure has a significant effect on decision-making. 27.3% of primary cesarean deliveries, these are mothers who have not had a cesarean before, are due to a non-reassuring fetal status as detected by electronic fetal monitoring. The issue with the practice of continuous electronic fetal monitoring is that there are questions about whether this practice is evidence-based, even though it has become the standard of care in the United States. Let's start with talking about what a normal heart rate is for your baby. Your baby's normal heart rate baseline is typically between 110 and 160 beats per minute. Tachycardia describes a heart rate higher than 160 beats per minute. Bradycardia describes a rate lower than 110. Your baby's heart rate naturally fluctuates, and this normal variation is called variability or beat-to-beat variation. A healthy range of variability is usually 5 to 25 beats per minute. It's also normal for your baby's heart rate to speed up temporarily. This is known as an acceleration. These can happen when your baby moves, if your doctor or midwife presses on your belly to check their position, if your provider touches your baby's head during a vaginal exam. These are short-term changes in the heart rate and are completely normal. Your baby's heart rate changes during labor. Labor and birth are the most physically demanding events of your baby's life. Every time that you have a contraction, blood flow to the placenta temporarily decreases, and that briefly reduces your baby's oxygen supply. I know this sounds very concerning, but it is completely normal, and it's part of how the body is designed to function during labor. That reduction in oxygen is short-lived, and your baby's oxygen levels return to normal as soon as the contraction ends. When the oxygen supply to the placenta dips during a contraction, your baby's heart rate naturally slows down. Then, once the contraction passes, their heart rate will return to its usual range. This pattern is expected, and your baby is well equipped to handle it. One thing that your doctor or midwife is looking for in monitoring heart rate is fetal distress. This is identified by looking for significant changes in a baby's heart rate. Remember, your doctor or midwife is looking at this as a measure of your baby's well-being. If a baby is not receiving enough oxygen in the womb, then their heart rate decreases, and the goal of electronic fetal monitoring is to identify babies who are low on oxygen and determine the underlying cause so that it can be corrected. A risk of having low oxygen is metabolic acidemia. This occurs when a baby is deprived of adequate oxygen for over 60 minutes. This can increase the risk of complications after birth, including cerebral palsy. This is a condition that's caused by abnormal brain development or damage to the developing brain that affects a child's ability to control their muscles. About 85 to 90% of cases of cerebral palsy are congenital, meaning that they occur before or during birth. Of all congenital cases, only about 6% are linked to birth complications that interrupt the oxygen supply. If you are worried about your baby developing this condition due to reduced oxygen during birth, it's important to remember that this is a very rare complication. If your baby's fetal heart rate slows down or decelerates, a care provider can take several measures to improve oxygen flow. This could include things like changing your position, administering oxygen to you, adjusting or stopping medications like Pitocin, that is the synthetic version of oxytocin, or by maneuvers to relieve pressure on the umbilical cord. A fast heart rate, tachycardia, remember that's over 160 beats per minute, can indicate things like an infection or a placental abruption. Monitoring your baby's heart rate can alert your care provider if an emergency arises and your baby needs to be born right away. In those cases, interventions like a cesarean section or an assisted vaginal birth would be used. Assisted vaginal birth would use a tool like forceps or a suction cup to help your baby be born. With all of this talk about an abnormal heart rate pattern, that doesn't always indicate a serious problem. Before your doctor or midwife recommends a cesarean, they will attempt to determine the cause. In many cases, something as simple as changing your position can help restore oxygen flow to your baby. The American College of Obstetricians and Gynecologists has specific clinical guidelines that define what is considered normal for fetal heart rate patterns. And these guidelines identify tracings into 3 categories. Category 1 is normal. This pattern indicates that the baby's heart rate is between 110 and 160 beats per minute with normal variability. There are no concerning decelerations, and early decelerations or accelerations may or may not be present. Overall, this pattern suggests that the baby is well oxygenated and is tolerating labor normally. I'm going to come back to category 2. Let's talk about category 3. This is considered abnormal. This pattern shows no variability and signs of distress like repeated late or variable decelerations, a consistently slow heart rate, or a wave-like pattern. Category 3 tracings suggest that the baby may not be getting enough oxygen and usually requires immediate attention. So we covered Category 1, which is normal, Category 3, which is abnormal, Category 2, which is indeterminate, is everything that does not fit into Category 1 or Category 3. It could include fast or slow heart rates, reduced or marked variability, or certain types of decelerations. These patterns are not clearly normal or abnormal and really require closer observation or intervention to prevent progressing to Category 3. So Category 2 is kind of a catch-all if the findings aren't clearly Category 1 or 3. This 3-tier system is not perfect, and researchers have proposed a 5-tier color-coded classification that provides more detail about levels of risk. There was a small study that found the 5-tier system identified fetal acidemia more accurately than the current system. In the future, perhaps we will have a more refined classification system so that providers can better assess fetal heart rate patterns. ACOG has acknowledged the limitations of the three-tier system, and they have emphasized the need for large prospective studies on fetal heart rate assessment and management strategies to provide clearer guidance and improve the care of pregnant patients during labor. You would think that a procedure that affects 90% of birthing mothers would be more of a priority research-wise. Hopefully, we'll see more data on this in the future. The method of monitoring your baby's heart rate really depends on your doctor or midwife, the policy of the hospital or birth center where you have your baby, your risk of complications, and how your labor progresses. Your care provider will monitor your baby's heart rate using one of two methods: auscultation or electronic fetal monitoring. We've talked a little bit already about electronic fetal monitoring. Let's cover auscultation. This means periodically listening to your baby's heartbeat. This can be done with a Doppler transducer, a fetal stethoscope, or a Pinard horn. That's a trumpet-shaped device that amplifies sound. In most cases, a Doppler is used. This looks similar to a microphone. When it's held against your belly, you can hear your baby's heartbeat amplified through a speaker. This is something you are likely familiar with because this is commonly used during prenatal appointments. According to ACOG, there is minimal evidence to guide the optimal frequency for auscultation. They refer to the American College of Nurse Midwives and the Association of Women's Health, Obstetric, and Neonatal Nurses that recommend intermittent auscultation every 15 to 30 minutes during the active phase of the first stage of labor and every 5 to 15 minutes during the second stage, as long as both the fetal heart rate and labor characteristics are normal. The frequency of this in reality may vary, and ultimately it's up to your doctor or midwife to decide how often they check your baby's heart rate. Back to electronic fetal monitoring. This uses instruments to continuously record your baby's heartbeat and your contractions. The machine, which is called a cardiotocograph or a CTG, provides an ongoing record. This allows your care provider to review how your baby's heart rate and how your contractions change over time. Those results are seen on a printout. More often, we're seeing these on screens. ACOG does not specify how often fetal heart rate tracings on an electronic monitor should be reviewed. They recommend that nurses or obstetric care clinicians review these tracings frequently, and that a member of the clinical team should periodically document fetal heart rate tracing assessments at frequencies established per individual hospital protocols. And this brings up a fantastic point. It is important for you to note every facility, any hospital, any birth center may have its own protocols and policies in place that will impact your care. You have the basics of electronic fetal monitoring. This can be either external, internal, or both. External monitoring involves two belts wrapped around your abdomen. One is using a Doppler to detect your baby's heart rate. The other measures the strength and timing of your contractions. This is the most common type of monitoring, and it's considered non-invasive. It's just belts that are strapped around your belly. However, because those belts are connected to the CTG machine by wires, your ability to move around may be limited. If external monitoring is not producing a clear signal, or your care provider needs a more precise reading, they may recommend internal monitoring. This method involves placing a thin wire called an electrode on your baby's scalp. This theoretically should be the body part closest to your cervix. That electrode is secured in place with a tiny spiral wire, in the baby's scalp to record the baby's heart rate. Contractions with internal monitoring can be measured using an intrauterine pressure catheter. This is a small tube that is inserted through your vagina into the uterus. Internal monitoring is only used after your water has broken and you are dilated 1 to 3 centimeters. This is something that could be recommended if you're carrying twins, because if they attach an electrode to each baby, they can distinguish heartbeats between baby A and baby B. Or if you are significantly overweight, which can make it difficult to get an accurate signal externally. Although internal monitoring is generally safe, it's not routine, and it does carry a small risk of infection and may cause minor bruising on your baby's scalp. Also, you may feel some discomfort when the electrode is placed. This method would not be recommended if you are HIV positive or if you have an active HSV infection. That's the herpes simplex virus. Internal monitoring also further limits mobility. So if this is something that is done, you will need to stay in bed once it's in place. Next, we're going to talk about really understanding your options and talk about the evidence on the pros and cons. Before we do that, I would like to thank the sponsors that have supported this episode. Many companies offer exclusive discounts for pregnancy podcast listeners, and you can always see discounts and promo codes at pregnancypodcast.com/resources. VTech offers a wide range of baby monitors, and as the #1 baby monitor brand in North America, they are trusted by millions of families to deliver crystal clear HD video, reliable performance, and strong night vision. The Advanced HQ Max is built for parents that want an easy-to-use, secure monitor without the need for Wi-Fi or apps. There's a large 7-inch screen and crisp real-time video that provides reliable monitoring without the lag. This has a secure no Wi-Fi operation. There are no apps or internet required. You can remotely pan, tilt, and zoom. There is a wide angle lens, a 12-hour rechargeable battery, plus things like a multicolor adaptive nightlight, built-in soothing sounds and lullabies, temperature sensors with alerts, motion detection notifications, two-way talk and infrared night vision, and a private 2.4 gigahertz connection with an encrypted signal. The Advanced HQ Max is perfect if you want private, no-fuss monitoring with premium features. Save 20% with the code VTPodcast20 and check out the VTech Advanced HQ Max at pregnancypodcast.com/HQMax. Centella asiatica is an incredible herb that has been shown in clinical studies to effectively prevent stretch marks in up to 89% of pregnant women. The best Centella asiatica product that I have found for stretch marks is the True Belly Serum by 8 Sheep Organics. It contains 85% pure Centella asiatica extract and is specially formulated to effectively prevent and fade pregnancy-related stretch marks. Like all 8 Sheep products, the True Belly Serum comes with a 100-day happiness guarantee. You can try it completely risk-free for 100 days. If you feel like the serum has not worked for you, or if you're not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. You can check out the True Belly Serum and get 10% off when you go to pregnancypodcast.com/8sheep. That's pregnancypodcast.com/8sheep, the number 8 and sheep like the animal. 8 sheep. let's get back to today's episode. If you plan to have your baby at home or at a birth center, your provider will likely monitor your baby's heart rate intermittently using auscultation. This method allows you to move freely and does not require specialized equipment like a CTG machine, which is usually only available in a hospital setting. If you transfer to a hospital, or if you are planning on a hospital birth, your monitoring options, including whether it's intermittent or continuous, may differ depending on your specific circumstances. Some reasons that your care provider may prefer continuous monitoring are if you get an epidural, if you have Pitocin, remember that is synthetic oxytocin that is used to induce labor or to augment your labor, or if you are high risk or run into any complications. A few examples of things that could make a pregnancy high risk include gestational diabetes or high blood pressure, or in cases where your baby is not developing or growing as well as they should be. Monitoring practices and options can vary widely between hospitals, birth centers, home settings. Even within the same hospital, policies may differ depending on your provider, your pregnancy risk factors, and how your labor progresses. Before you go into labor, it can be very helpful to understand how fetal heart rate monitoring typically works and what options are available to you. First, let's talk about monitoring when you get to the hospital. If you plan a hospital birth, it is very common to get hooked up to a monitor for about 20 to 30 minutes when you first arrive in labor. This initial monitoring helps your care team assess how your baby is handling contractions and establishes a baseline heart rate pattern. If everything looks reassuring after this initial monitoring session, you may be able to have the belts removed and then switch to intermittent monitoring. Research shows that routine monitoring upon admission does not necessarily improve outcomes. One Cochrane review found no evidence of benefit from using electronic fetal monitoring upon admission. In fact, the study found that this practice increases the likelihood of a cesarean birth by about 20%. Based on the findings, the authors recommended that an admission CTG not be used for women who are at low risk when they arrive at the hospital in labor. The authors also emphasized that patients should be informed that admission monitoring is associated with a higher rate of cesarean birth without clear evidence of benefit. I've touched on this, but it's important to understand how electronic fetal monitoring can limit mobility. If you have continuous electronic fetal monitoring, this limits your ability to move during labor because you are connected to a machine with wires. Research shows that the most effective labor positions are not on your back in a hospital bed. Moving and trying different positions can help labor progress and may even shorten its duration. Now, continuous electronic fetal monitoring does not mean that you are confined to a bed. It does mean that you need to remain close to the CTG machine. Continuous monitoring can also prevent you from laboring in the shower or having a water birth. Some monitors are waterproof. However, not all venues may carry this option. If you are planning to use hydrotherapy, I would talk to your doctor or midwife to find out whether waterproof monitors are an option or find out if you can do intermittent monitoring. Some hospitals offer telemetry monitoring as an alternative to standard electronic monitoring. A telemetry monitor uses a small transmitter, this is usually placed on your thigh, and it sends your baby's heartbeat data to a nurse's station using radio waves. This setup allows you to move freely, so you don't have to remain right next to a CTG machine. You can walk around during your labor, and your baby's heart rate is continuously monitored. Not all hospitals have telemetry monitors, so if this is something that you were interested in, talk to your doctor or midwife about whether this option is available where you plan to give birth. Telemetry monitoring provides much more mobility than a traditional CTG machine, and it still allows for continuous monitoring. A Cochrane review analyzed 13 trials involving more than 37,000 women who were randomly assigned to either continuous or intermittent fetal monitoring. The review found no difference in the number of babies who died during or shortly after labor. Neonatal seizures were rare, but did occur slightly less often with continuous monitoring. There was no difference in the rates of cerebral palsy. However, continuous monitoring was associated with a significantly higher rate of cesarean and instrumental vaginal births. This suggests that while continuous monitoring may slightly reduce the risk of rare neonatal seizures, it also increases the likelihood of interventions during birth, like a cesarean or an assisted vaginal delivery. Electronic fetal monitoring is almost always used in situations where the baby is considered high risk. And this makes sense on the surface. But there is no hard evidence that continuous electronic fetal monitoring has improved outcomes for babies in high-risk pregnancies. This is something that is echoed in that Cochrane review that I mentioned. After going through all of this research, you may be wondering why hospitals continue to use continuous electronic fetal monitoring as the standard practice. And I want to mention the factors that contribute to this. First, this is a very well-established medical practice. Continuous electronic fetal monitoring has been the standard for decades, and it remains deeply ingrained in the medical model of obstetric care. Training and familiarity influence your provider's practice. Obstetricians, doctors, nurses, medical students receive more training in using continuous electronic fetal monitoring and interpreting those tracings than they do in intermittent monitoring or auscultation. There is some speculation that hospitals may use continuous monitoring for liability concerns. If you'll recall, ACOG defers to hospital policy on how often these fetal heart rate tracings should be reviewed. Continuous monitoring does create a record, which could potentially be used to help defend against malpractice claims that are related to birth complications. Also, continuous monitoring reduces staffing demands. This allows providers to track labor progress remotely rather than being physically present in the room. This means that you can monitor more patients with a smaller team. As an example, during the COVID-19 pandemic, hospitals expanded continuous monitoring because it limited staff exposure to patients, and it supported observing this centrally from a nurse's station rather than having individual staff members have to go into patients' rooms. Some parents may wonder, well, why on earth would you not want to utilize a monitor that ensures that your baby's doing well? And the key is understanding that every method of monitoring your baby's heartbeat has pros and cons. And like so many birth interventions, this is not a simple choice between two extremes. It's not either you decline all monitoring or you have continuous internal electronic monitoring. The more that you really understand your options, the more confident and informed your decision will be. Although electronic fetal monitoring is often continuous, it does not have to be if both you and your baby are doing well. Ask about the policies of the hospital or birth center for continuous monitoring, and ask whether telemetry or waterproof options are available. This is a fantastic topic to discuss ahead of time with your doctor or midwife. That can really give you a sense of how they typically handle fetal heart rate monitoring. You and your care provider share the same goal, which is to keep you and your baby safe while supporting the birth experience that you want. Electronic fetal monitoring should always involve informed consent, so you can take what you have learned in this episode today and have an informed discussion with your doctor or midwife about your preferences and how different monitoring methods may fit into your situation. You always have the right to decline or request a specific approach, and your doctor or midwife can help you navigate this decision given the particulars of your labor. If you choose electronic fetal monitoring, or this is an intervention that is utilized during your labor, a few adjustments can make this experience more comfortable. First, you have to know the machine has a volume control. If the sound is distracting, you can lower the volume. You can also turn the monitor so that it's not right in your view. You may find it helpful to listen to the heartbeat or to watch the tracings on the screen, or you may prefer to tune it out. While it can be a distraction for you, it could also be a distraction for your partner. Encourage your partner to focus on you, not on the machine. So if it's distracting them, you can also turn it down or turn the screen away. If you are paying attention to the CTG machine, if the sound suddenly stops, please do not panic. The transducer likely shifted out of place. This is something that a nurse or your care provider can very easily adjust. Also, do not worry if the heart rate changes, and remember that there are many variations that are completely normal. It's natural to want to understand what all of these readings mean so you can have some peace of mind that your baby is doing well. Leave interpreting the monitor's readings to hospital staff and keep your attention on the experience of meeting your baby. Fetal heart rate monitoring could be an intervention that you may want to include in your birth plan. While it's great to get all of your preferences on a concise sheet of paper, the real value of a birth plan lies in the preparation. And it's really in discussing your preferences with your doctor or midwife ahead of time so that the two of you are in alignment. If you are not sure where to start with your birth plan, the Pregnancy Podcast has a lot of resources for you. There's a full episode that is a guide to creating your birth plan. You can request a copy of my birth plan so that you can see a sample of how one could be structured and worded. There is the Your Birth Plan book. And of course, that is free for Pregnancy Podcast Premium members. I will put links to all of the birth plan resources at the end of the article for this episode. To recap today's episode, we talked about electronic fetal monitoring, what a normal heart rate is for your baby, how that can change during labor, how your doctor or midwife is keeping an eye out for fetal distress. I touched on the risks of low oxygen and how your provider can respond to concerning heart rate patterns. We talked about how these results are interpreted with category 1, 2, and 3. Then we went through all of the types of fetal heart rate monitoring, including auscultation and electronic fetal monitoring, which could be external or internal or both, and also can be continuous or intermittent. I talked about how it is common to monitor you upon getting admitted into the hospital. We talked about a Cochrane review that found no evidence of benefit for that procedure. I covered mobile monitoring with a telemetry unit, also that there are some waterproof options if you plan to utilize hydrotherapy. We talked about some evidence on continuous and intermittent monitoring, monitoring high-risk pregnancies, really gave some reasons why hospitals like to use continuous electronic fetal monitoring, and wrapped up talking about how you make a decision on this. This is really something that you should discuss with your doctor or midwife because there are a lot of factors to consider. And ended the episode talking about some tips for electronic fetal monitoring. Things like turning the volume down, turning the screen away if it is a distraction, and not getting too wrapped up and paying attention to what's on the monitor. I would like to thank you for tuning into the Pregnancy Podcast today. I hope you find this episode helpful. Please share this episode if you have a friend who's pregnant. So many listeners discover the podcast through recommendations, and I appreciate you sharing. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see all of the resources that accompany this episode at pregnancypodcast.com/monitoring. Reminder that you have just 1 week left to take advantage of a super exciting offer for Pregnancy Podcast Premium. Right now, if you sign up for a 3-month membership, you get ad-free access to every episode, the complete archive, a copy of the Your Birth Plan book. You also book a 30-minute private call with me. We can go through your pregnancy questions. We can work on preparing your birth plan. I'm happy to chat about anything that can help you feel more confident and prepared for your baby. Of course, I am not a doctor. I cannot give medical advice, but I am a wealth of information and I am an expert at connecting you with evidence-based resources. Over the last decade, I have helped tens of thousands of expecting parents navigate pregnancy and birth, and I'm super excited to work with you one-on-one. This is a limited time offer available only through the Pregnancy Podcast website. And this offer is available through October 31st, 2025. You'll get ad-free listening, full archive access, and we get to hop on a call and tackle whatever you're struggling with in your pregnancy. We can plan for your birth or even help you prepare for postpartum. Check it out at pregnancypodcast.com/premium.